Good morning and welcome. My name is David Blackburn. I'm your Bell County Judge. The purpose of today's briefing is to allow representatives from our area healthcare providers to give you more or less a situational awareness of what's going on in Bell County with regard to COVID-19 and the current impact that's having on their providing services to the residents here in Bell County and to the region. The format for this briefing is as follows. I'll introduce each of the representatives. They'll come forward. They'll have a few minutes to give you an overview of the current situation that they're seeing at their respective facilities. They may also provide you some additional information relating to their current needs or issues or anything else they would like to comment on. Following their comments, we'll provide some time for question and answers. I would ask if you could hold your questions until all of the providers have had an opportunity to make their comments. And then at the end of that, if you would I'll come back up to the podium. I'll introduce each one along the way, but I'll come back up to the podium and ask if there are any questions. If you could ask or direct those questions to a specific representative. You don't have to remember everybody's name right now, but we'll have it out there. But if it's a Baylor Scott and White question or an Advent or a Seton question, please indicate so. If it's a question for all of them, then that's fine too. And we'll do that. The idea here is we're going to try to just keep one person at the podium at a time. And so they'll come to the podium, exit, come to the podium. And that's the format. Okay. All right. First speaker that I'd like to introduce is our interim director for the Bell County Public Health District. She's been that since late May of 2021. She is also the WIC program director and has worked with the health district for over 20 years, serving women, infants, and children in the Bell County through the WIC program. I'd ask Ms. Morrow if she could kind of give just a general overview from the public health district standpoint. Ms. Morrow?
Good morning. My name is Nikki Morrow, and as the judge said, I'm the interim director for the Bell County Public Health District. The health district began reposting the dashboard in early July as COVID-19 positive cases and incident rates began to rise. The dashboard can be found on our homepage of our website at www.bellcountyhealth.org. The dashboard is updated daily, Monday to Friday in the late afternoon by our chief epidemiologist. As of yesterday, our dashboard showed 1,664 active cases, 472 deaths, 458 per 100,000 for incident rate. Our current vaccines for our area show us at 34% for fully vaccinated of those eligible 12 years and older. The most recent death count was reported to us on Tuesday, August the 10th, but occurred in late July and was an 80 to 89-year-old female. Currently, the health district is working with a variety of community partners, businesses, schools, social service agencies, churches, and other facilities. Our immunization team and community health educator are reaching out across our county daily to provide public health education, vaccine administration, and group vaccine events. Our health authority, Dr. Janice Smith, and the health district continue to provide COVID-19 safety guidance and recommendations to various entities during the current climate. We are working with partners to address health disparities as well. We have provided vaccine clinics at local social service organizations located in areas where transportation and vaccine accessibility is a challenge. We also continually work with long-care healthcare facilities to ensure both residents and staff practice safety measures to mitigate the spread, especially among our at-risk population. Efforts are being done at the ground level with educational materials and outreach activities and events. Social media and outdoor advertising efforts are being utilized, especially in some of our lower vaccinated zip codes and areas where we see the highest case rates. We are focusing on vaccine efforts locally and other appropriate safety measures to slow the spread of COVID-19. The health district, local hospitals, and healthcare facilities, county leadership, and emergency response teams are all working side by side to encourage vaccination or masking to slow the spread of COVID-19. Increasing our local vaccination rate is of its utmost importance for those fully vaccinated and encouraging Bell County residents to take necessary preventative measures to protect themselves by wearing a mask until fully vaccinated in order to help slow the spread of the virus and help protect you, your family, and our community.
Thank you, Ms. Morrow. Let me provide one more bit of context, I guess, for the morning. And that is, first of all, would you silence your phones? It will disrupt the comments and speakers if you haven't already done so, so please do so. One more bit of context. For the entire month of August, our healthcare facilities, our hospitals, have been above the 15% threshold for COVID patients in their facilities. That issue, that concern, we've been tracking very closely. I've had discussions not every day, but most days of the week with healthcare providers, emergency management officials, and others over the course of the past couple of weeks, as we've tried to identify what the needs and the issues and the concerns are associated with our healthcare delivery in Bell County. And so as a result of, again, our hospitalization rate, the number of beds that are being taken up right now by COVID-19 patients in those hospitals, again, it seemed like a good opportunity to bring representatives for those healthcare facilities into the room and let them share firsthand with you what they're seeing and what their needs and concerns are. So with that backdrop, let me introduce Dr. Stephen Sivit. Dr. Sivit is board certified in internal medicine, currently serves as the Chief Medical Officer for the Temple region of Baylor Scott and White Health. Dr. Sivit.
Thank you all. I just want to start off by asking, everybody feel comfortable I take my mask off? I think so. Okay, but I had to ask. All right. Well, I'm gonna paint the picture as it is in our reality. Okay. So we're the only level 1 trauma center. We're also ranked by IBM Watson as the #2 major teaching hospital in the country. All right. In order to find a facility that can do what we can do, you have to go all the way to Austin or all the way to Dallas. We are it for this area. So we stand as a facility that takes in a lot of patients from surrounding facilities that do not have our resources or capabilities. We thrive in that. We thrive in knowing that we're there to help. We're there to help the patients that show up at our community hospitals, whether they belong to Baylor Scott White Health or they belong to somebody else. It doesn't matter. We accept the people who want to come to us. What's happening right now is today, and for the last couple of weeks, we've seen a tremendous growth in the number of COVID patients in our hospital. Currently, right now, about 1/3 of our beds are occupied by COVID patients. Now, when you consider that, no other disease entity occupies 1/3 of your beds. All right? Right? That is putting a tremendous strain on our existing staff. All right? We are struggling, but we are taking great care of those patients. But what is the result of the number of these patients coming into our building? Right? The end result of these patients coming into our building when we are at capacity is we have to find a way to care for these patients as they flow into our emergency room. You show up to our clinic, you show up to our emergency room, we're going to take care of you. You might be standing in line a little bit, but we are going to triage you and we're going to get the sickest of the sick in, but we're going to get everybody in. The issue is we've had to force ourselves, happily to do so, to create additional beds. We've had to use patient care area that's been old and taken out of use, and we've had to transition it into ICU beds. All right, that's first and foremost. ICU beds, we are at 130% of capacity. Well, we don't have 130% capacity of nurses. So our nurses are being strained by this additional work that they need to do. 130% of a very large ICU. So again, we are 1/3 of our patients. The vast majority of patients that are coming into our facility are unvaccinated. 91 to 92% of the patients that come into our facility, unvaccinated. All right. Not only that, we're seeing younger patients. Our average age, probably in the lower 50s. Right. That is a significant difference from our last surge back in December, January. Not only that, we're seeing more pregnant women and we're seeing children. And I know my colleague, Dr. Lucia from McLean Children's will talk a little bit more about that. All right, so what are we doing? How do we address that when you're at extreme capacity? when you can't fit more people into your building, you're creating areas to care for patients, and you're needing nurses. Well, we don't have additional nurses. So what are we doing? Well, we're canceling surgeries. We've canceled all elective surgeries effective Monday. Why? Because the ORs have a significant amount of personnel. You're freeing up doctors, you're freeing up nurses to help in the care of these COVID patients that are coming into our building. So we have stopped all elective surgeries. Well, that's impacting somebody. That's impacting your grandmother who may have an arthritic hip that needs replacement, and she can't walk around. She has to use a wheelchair because of the pain. She's in excruciating pain. Well, we have to postpone that. So that decision alone has impacted our community, and the ability of what we want to do is care for the individuals in our community. Right? That's one impact. The other impact, again, relates back to our ability to take patients from other facilities. Again, there are sick people. There are your family members. There are your relatives. There are your friends who show up into area community hospitals that we have to say no to because we just don't have a bed to place them in. My colleagues who you'll hear from attempt to pick up the phone and call us and ask for help. We will always do our best. We spend all day looking for that next bed to put a patient in, and we do our very best to do that. But more often now than not, we have to say no. So it's impacting our ability as the only level 1 academic trauma center in the region to help others. That bothers us. As a clinician, that bothers us. We thrive on helping others. The biggest impact is I'm going to have to paint a picture for you. And I don't know how many parents are in this room, but I think quite a few parents. I'm a parent. I'm raising my 3rd child, raised 2. But there is a vivid picture in my brain, and if you're a parent, you will understand this. At some point in time with your children, you've seen fear in their eyes, whether it's a bad dream, whether it's for tripping and falling and scraping their knee, maybe because they're anxious of going into college, but they're intimidated and they are fearful. And you see that fear. That fear drives compassion and this deep sense of wanting to help. All right, let me fast forward to what's happening in our buildings. The worst sequelae of COVID-19 is an inability to breathe. You can't breathe. You are struggling to breathe at its extreme sense, and that's why patients are coming into the building most often. When you're dealing with an adult who shows up to your facility and they can't breathe, for a clinician, that is a stressful situation. We're trained to take care of it. We know we can competently take care of it, but it's stressful. And what else you see? You see that same look of fear in somebody who can't breathe. All right? So it's a fearful situation. You're dealing with a fearful patient. Now translate that into what we're also seeing with this Delta surge. And by the way, I'm sorry, the majority of the patients that are coming in now, it's almost 100% Delta variant. But when they come in, imagine now a pregnant woman having to stand at the side of the bed and tell them that we need to put you on a mechanical ventilator because you can't breathe and you can't oxygenate your blood, and that threatens you and that threatens your unborn child. Do you think you see fear in their eyes? Absolutely. Fear for themselves, fear for their unborn child. They don't even know if they'll ever see their unborn child again when you intubate that patient. And then probably the most extreme, if that wasn't the most extreme, remember that your children and the fear in their eyes? Imagine your child can't breathe showing up to our children's hospital. That's exactly what's happening these days. And the concerning issue is that it's preventable. The vast majority of patients in our building are unvaccinated, irrespective of what you think about personal vaccination. Vaccination lowers hospitalizations. Vaccination lowers death rate or mortality, and it eases symptoms. It's unequivocal. So vaccination is our first and foremost weapon against defeating this virus. If you can't do that, mask, hand hygiene, social distance. That is not going to eradicate the virus, but it will help slow. And right now, us caregivers at other facilities as well, we need a slowing of what's coming into our facilities. All right, our people are tired. We will again continue to care for everybody who shows up, but doing this would help us help you all. So again, that mother, that child that are coming in, that adult who can't breathe and have that fear in their eyes, that's what is at all these other facilities that are trying to get to us, and they can't. We need the community's help. This is real, it's having a tremendous impact, and our job is to care for you all. Let us do it well. Thank you, Judge Blackburn.
Thank you, Doctor. I'd like to introduce now Dr. Dominic Lucia, who is the pediatric emergency medical physician, currently serves as the Chief Medical Officer for Baylor Scott & White McLean Children's Hospital. Doctor.
Thank you, Judge Blackburn, for the opportunity. I'm going to take my mask off as well. A lot of things very well said by Dr. Sibbett. I can bring maybe a little more detail to the pediatric situation. The first message we need to get across is the Delta variant is a very different disease process as far as contagion, and that's across the board, but certainly as far as it affects kids. We've seen it recently in our numbers. Our numbers of hospitalized kids all last year, and even during the worst points, was 0 to 3% of our hospital beds. Now it's currently 10 to 15% of our hospital beds. Yesterday, we were at 15%. This is on top of an already very heavy RSV season, a very heavy summer pediatric trauma season, and adenovirus, rhinovirus, all the other things that kids have, we've had unprecedented numbers of this summer. When you look at our pediatric positives across the board, back in February, even at its worst point, they're around 10%. In June, they're around 2%. The last 2 weeks, they've been 17%. So this is a different disease almost as it pertains to the pediatric population. And yes, we're seeing a lot of kids. A lot of them are grumpy and feeling terrible and fortunately do get to go home. But unfortunately, there's others that actually have to come into the hospital and receive a variety of different treatments, whether it be oxygen, fluids, steroids, and some of the worst, which actually end up in our ICUs, do end up requiring oxygen, whether non-invasive or invasive, which means being on a breathing machine. We also are suffering the same capacity issues that we saw the adult hospitals suffer in prior surges and are suffering now. So we are day-to-day as far as our capacity. We also are a tertiary care pediatric trauma center. We're a level 2 pediatric trauma center, one of 3 in the state. We take care of pediatric cancer patients. We take care of all comers in this community. We're the only pediatric hospital between Austin and Dallas. We serve a large catchment area, certainly east and west of us as well. So we need to be there for the patients and their families in our community and be able to take care of all folks that come in. And when you look at COVID and the rates of increased sickness and hospitalization, both in our clinics, our EDs, and our hospital, it's very concerning. And we're also very worried about school starting next week. We're worried that those that can't get the vaccine, those that are under 12, those that can't protect themselves, we're going to be unable to actually keep them safe. On a normal year seasonal cycle, we start out at a fairly low census in our hospital, and as school starts, we rise rapidly. This year, we're starting out very high already. So we're unsure what will happen when school starts. We're obviously worried. We're making all sorts of plans to try to mitigate any stress that can cause on our system. But we suffer the same issues as far as being able to take pediatric patients from outlying hospitals, being able to serve the community that's greater than the Temple, Belton, Killeen region and accept those transfers. We were fortunate enough last week to actually be able to take a transfer from Houston. You may have heard about that case. That was an 11-month-old COVID positive patient. That particular day, we had an ICU bed available. That hospital, LBG Hospital at Harris Health in Houston, had called the entire Houston healthcare system looking for a PICU bed for that patient. They were unable to find a PICU bed for that patient. We were there to help. We want to be there to help. McLean Children's Hospital has been open nearly a decade at this point. We were here way before this pandemic. We're going to be here through it, and we're going to be here after it. We all live here. I have 5 children myself, okay? We all are in this community. We have friends, and our kids attend the schools and are in groups and sports. So we're here pleading with you as your neighbors and friends to pay attention to this. If you're vaccinated, if you're able to get vaccinated, please do. And then when you talk about getting back to school and gathering in groups, of strongly urging you to consider wearing masks, washing hands, and doing the social distancing things that helped us last year eliminate flu and RSV for such a long time. We know these things work. We know that during this very aggressive surge, they're one of the tools that we have. They're not perfect tools, but they're tools that we have, especially to protect the unvaccinated. And with that, I'll take questions later. Thank you.
Thank you, Doctor. At this time, I'd like to call on Dr. Aaron Bird, who is the Chief Medical Officer for Advent Healthcare Central Texas and Advent Health Rawlinsbrook. Thank you, Doctor.
Thank you, Judge Blackburn, for organizing this meeting. I'm humbled to represent our 1,000 healthcare team members who are working tirelessly to keep our community safe and healthy. Not too long ago, around May 27th, our COVID-19 census at Advent Health Central Texas was 0. You may recall the first week of July, Colleen had an outbreak of COVID cases, and that was confirmed to be the Delta variant. Since that time, our emergency department has seen an increase in visits. Our inpatient census of COVID numbers have increased, and it's surpassed our previous numbers. As Dr. Sibbett mentioned, we're seeing younger patients. We're having to put more patients on ventilators. Like Baylor Scott & White, this has caused us to pause all elective surgeries and procedures. Additionally, we're having to expand our COVID wards. We're adding overflow beds where possible. In our previous surges, it wasn't as challenging. And it wasn't as challenging because we had state staffing resources available. Without these state staff nurses, respiratory therapists, nursing assistants, we're relying on these same team members to continue to provide this care, and these team members are tired. We appreciate Governor Abbott's plans to provide funding to support the healthcare community, and we look forward to hopefully seeing these reinforcements in the near future. As my colleagues have mentioned today, our plea is that you consider evidence-based guidance that will help reduce this community disease burden. As Dr. Sibbett mentioned, we know what the data shows. We know that the data shows if you are vaccinated, you are much less likely to be hospitalized, much less likely to die from COVID. And I shared some of the more recent data with Bell County. Those rates may be as high as 85 times more likely to succumb to COVID if you're unvaccinated. For those reasons, we are encouraging our folks, our community members, our neighbors to go ahead and get a vaccine. And when they're in an environment where the threat of spread is higher, we're asking you to go ahead and mask up. These are environments where you may be enclosed and there may be unvaccinated individuals. Also, we'd like to encourage you, if you're just in need of a COVID test, that you go to a COVID testing site rather than the emergency department. Finally, I want to thank our doctors, our PAs, our nurse practitioners, our nurses, thank them over and over. Our therapists, our support staff, and our public health officials for their courageous commitment to our patients and community during these difficult times. As Bell County residents, we owe a debt of gratitude to our neighbors who are battling this every day to keep us healthy. Thank you.
Thank you, Doctor. Lastly, I'd like to call on Callie Travis, who is the Chief Nursing Officer. She has over 41 years of experience in healthcare at Seton here in Bell County. Welcome.
Thank you, Judge Blackburn. Seton Medical Center, Harker Heights, is the smaller facility of this group here today. And as such, we have been greatly impacted by the overflow that we are seeing from Baylor, from Advent, and from the outside rural areas. Our census of COVID positive patients fluctuates literally hourly. We're going anywhere from 50 to 60% of our total census of critically care ill COVID-19 patients, which has consistently put our facility at full capacity. Our ICU is currently full as of this morning. None of our COVID-19 patients that are in ICU, which is 90% of that full capacity, are vaccinated, and several of them are ventilated. Our COVID patients, as mentioned by my medical colleagues, are younger, 40, 50-year-olds, and we too are seeing a higher pediatric population come through. Our ED currently, for a small facility, we see between 140 to 160 a day. Many are testing positive for COVID. With our capacity issues, we end up holding in our emergency department, but we still continue to see the sickest of the sick. We see heart attacks, we still see stroke, we still see everything else that EMS brings. And I feel sorry that our EMS providers literally have to go hunt for beds. We strongly encourage our community to get vaccinated, to wear their masks, wash your hands, socially distance. What we are seeing are large spreader events that are occurring. These are family reunions, weddings, birthday parties, which create whole family infections. It has not been unusual for us to have a whole family come into our emergency room and need testing. The testing packages, the PCR test, we have to be careful how many that we use, though we could run out of those as well. Right now, the quantity is fine, but long-term, who knows? We're delaying any elective surgeries that are going to require a bed. Of course, we do emergency care. We see those people that need to have surgery, but overall, we're not doing any elective surgery. And if you do have a medical emergency, please call 911. I'd like to also thank the state and Governor Abbott for recognizing the dire situation we are in with nursing. COVID has decimated the nursing ranks. As a nurse for over 40 years, we've never had enough nurses. We just never have. The schools don't put them out fast enough, and we just don't have enough. And right now, we really need the help. We're tired, and this is the worst I've ever experienced in my career. I've never seen anything like this. The surge we're experiencing is placing significant staffing pressure on all healthcare facilities, and we are no exception. The minute we heard on Tuesday that the state of Texas was going to provide help, we immediately put in our request for registered nurses, respiratory therapists, and aides. We recognize the pressure that this is putting on everybody, and we see this frustration in our community every day in our hospital. We're working the best we can to provide the best, safest, efficient care possible to everyone that comes through our doors. We take care of the sickest of the sick every hour, and I would like to respectfully request that everybody be respectful. Right now, the frustration is high, and people are anxious and demanding, and right now with the capacity issues that we have, sometimes our times are delayed by hours. We're not talking 1 or 2, we're talking 4, 5, and 6. So remember, the critically ill, we triage first, and we take care of those first. I'd also like to bring up vaccination, and this is close to my heart. I still have a vaccination scar from my smallpox vaccination. How many of you have that? A few of you. I'd like for everybody to remember that we eradicated smallpox because of vaccinations, and smallpox killed millions of people. Polio is basically non-existent because of vaccines. So please, I beg you, don't believe everything you see on social media or here, especially from the people who have never trained in medicine or never taken care of a critically ill patient gasping for breath, knowing that they may not leave that hospital alive. We know it's confusing. There's a lot of different information. There's a lot of false information out there, but you have to trust somebody. This virus doesn't care who it infects. This virus is not a politician. All it does is move from one living host to another, infecting cells to replicate. That's all it does. Vaccination creates immunity, which makes that virtually impossible for it to do. And that's the only way we're going to get ahead of this. Vaccinations are what we need, and I just strongly ask you to get your vaccinations. Please help your community. Please help your healthcare providers, your families, and your friends. Get vaccinated. Thank you.
Thank you, Ms. Travis. Very much appreciate the comments, especially from the perspective of the nursing area of our healthcare. And doctors, thank also all of you for being here and for your comments. Let me just add a couple of things, and then again, we'll open up to questions and let them come back. Here's what I heard from all of those professionals, or what I took away. One is that the occupation of a hospital bed by a COVID-19 patient is both unnecessary and preventable if we will get vaccinated. It is both unnecessary and preventable. So please go get vaccinated. What I also heard was please do not go to the ER for COVID testing. It's going to be the longest wait and the most expensive way to get tested. So please don't go to the ERs to get tested. The other thing I was going to mention, or also want to mention, is in terms of vaccination sites around the county, we provided or will provide hard copies of, if you go to just escape vaccine.gov, you can pull up a list of all the vaccination sites in your area. We've printed off, I asked our public information officer to print off that list. There are 28 sites in Bell County right now where the vaccination is available. I went to 3-4 of those sites yesterday just to walk in, talk to the pharmacy managers, find out how it was going. All of them said that it was going very well. In fact, they said in the past week to 10 days, they have been busy seeing people getting vaccinated. That's good news. That to me tells me that folks are heeding some of the messages and the messaging that's going out there. But there are 28 locations in Bell County, across the county. So please, it's accessible. Locate those locations and the ones most convenient for you. In addition to that, there are 51 sites for vaccination within 45 minutes. So again, accessibility for the vaccine should not be a reason to not get vaccinated. It is very readily accessible across the county and across the region. One other comment I'd like to make, and it was, Ms. Travis referred to that, and actually a couple of folks did. But as y'all may know, yesterday afternoon, or at least my note came at 4:31 from the governor's office that he had announced the deployment of some 2,500 medical personnel to hospitals across the state to assist in the care of COVID-19 patients. You may recall a couple of days prior to that, the governor announced the opening of the procurement for those medical healthcare professionals to assist hospitals across the state. The hospitals have submitted their request for those additional personnel. We have submitted those requests in turn to the state officials that process those, and those are in process right now, as I understand it. We'll try to keep you updated, and obviously the hospitals, as to when and where those medical personnel are coming and when they're on the way. And the hospitals may know that before we do. But those requests, I just want to convey, have been made known by the hospitals, and they have been conveyed to the state. So we look forward to receiving that assistance here in Bell County. All right, at this time, I will pause or stop and see if there's any questions that you have. And if you would, again, identify yourself and identify the person or entity that you'd like to respond to the question. All right, Shane.
Yeah, I just, for any of the hospitals, I just want to see how would the kind of surge that's been affecting doctors and nurses, because I know it must take a lot of mental strain for that.
I'll let anyone who wants to come up address that.
Anyone's. It is a significant strain. Not only are they working harder and longer hours, they're having to deal with this. Several of our team members have personally come down with COVID as well. And then they come back to work and are put in the environment of taking care of more COVID patients. They're tired, they're worn out, but the one great thing about being in the healthcare entity, when there's a serious issue like this, and especially in this community, I've never seen it like this before and anywhere else in my career, I'm sorry, people band together. People band together and work together in a crisis to overcome the crisis. So you're seeing tired and fatigued healthcare givers, whether it's especially the nurses, but the physicians as well, the respiratory therapists as well. It doesn't matter what area of healthcare you're in, you're tired right now. They're tired, they're fatigued, they need a break. They need a break or we risk, losing them. But they're pulling together and they're pushing through this. That's what we're trained to do.
Are y'all seeing a lot of staff or nurses not wanting to get vaccinated? I know that there is a
Yes.
protest scheduled for Saturday. I mean, what's the perspective of that?
Well, I can tell you from the Baylor Scott and White Health standpoint, the reason we mandated vaccines for all of our healthcare staff is because it's very simple. Our job, our mission is to care for the community. And we can't do that if we start losing staff to acquiring COVID. So we need them to get vaccinated so we can maintain a healthy workforce, so we can provide care to patients, and so how we can help not spread the virus itself from healthcare givers. So,
Are you guys seeing any breakthrough infections?
yes, we are. We're seeing breakthrough infections, and I don't mind commenting on that. The vast majority of breakthrough infections are not in the hospital. Their symptoms are less. So that's one definite point of data that getting vaccinated, again, helps reduce infections, helps reduce getting infected, but if you are infected, helps reduce symptoms and hospitalizations, but it also, it also helps reduce mortality. Of those who are in the hospital because there's a breakthrough infection, I can tell you almost every single one of them has an underlying major disease that is impacting their body's ability to produce immunity. Okay?
Any idea of how many cases you guys have seen with Baylor Scott and White as far as breakthrough infections?
Yes. It's not the majority of cases in the hospital. It's about 8% of the cases in the hospital, of all of our cases.
I have a question for Judge Blackburn. Obviously, top of mind right now for everyone is getting back to school and schools opening. A lot of hands are tied as far as what can be done. What is the message or how are you guys working with the schools to ensure they're following the state guidelines and still
Yeah, I'd like to ask Ms. Morrow to come forward and talk a little bit about the cooperation, the collaboration that we've had and are ongoing with our school districts across the region. The health district has been really good, really exceptional about reaching out to the school superintendents. In fact, they meet and talk at least weekly and sometimes more often than that to talk about health protocols, procedures, policies, to try to stay in line with what the state requires, but also to follow the health protocols as closely as we can. It's a very difficult and challenging environment right now in the school districts. There's no doubt about that. And the start of school is going to represent a huge challenge for everyone. But I'd like to ask Ms. Morrow to come forward and address that too.
Sure, thank you. Yes, we are meeting with the school districts by virtually on meetings every week to every other week and providing guidance to them. Our health authority, Dr. Janice Smith, has created a toolkit for them with some guidelines that they're able to follow that, again, follow what we're trying to do in public health to make sure our community is safe, but also assist them with keeping that in line with the state policies as well. So they are being very proactive. Our schools are very concerned about COVID in the school system this coming up year and trying to make sure that students and teachers are safe. Everybody wants to have a normal school year this coming up year and avoid some of the things that we encountered this last year and a half. And they're working with us to set up vaccine events regularly. We have several that we've done with different school districts. They're also working with Baylor Scott and White on vaccine events to try to help increase the vaccine rate among the teachers, the staff, the students, and the rest of the community. So a lot of these are walk-in, they're open to the public, and we're also providing the regular back-to-school vaccines whenever we're doing these events too. Thank you.
I have one more question. If the governor rescinded his mask mandate ban, would you guys encourage school districts to go ahead and reinstitute their mask mandates?
We're going to encourage the school district to do anything possible that's going to help to keep our community safe.
Okay.
Thank you.
I actually have a question for you. So if I understand this correctly, Travis County and Austin issued orders last night for masks. So people are gonna have to wear them in schools and having official buildings. Is Bell County thinking about instituting something similar here?
I do not have a comment on that. I'll let Judge Blackburn comment on that.
I'm aware of multiple counties across the state. Probably last count I saw was maybe a half a dozen counties across the state. Most of them are in the major urban areas that have issued either orders or legal challenges to the governor's orders. My understanding is, and I've got the notification last night, but there have been previous attempts or litigation filed at the state level challenging the governor's orders. Those orders have all been upheld at the highest court in the state. Last night, the governor's office and the attorney general filed an appeal to the Fifth Circuit Court of Appeals from the federal into the federal court system. So that's a long answer to all of those orders that are being issued right now, in my view, across the state at the local jurisdictions do not have full force and effect of law. The governor's orders are still the law of the state until they're finally resolved at the court level, which they are not.
How does that make you feel?
Pardon?
How does that make you feel that you can't enact any regulations?
Well, I took an oath of office to uphold the law when I took this office, and the governor's orders are the law of the state of Texas with regard to how we manage and address our COVID situation. So we're going to continue to do everything we can, working with our healthcare providers, working with our health district, working with healthcare professionals to use every tool and every resource we have under those orders to try to mitigate the impact and spread of COVID-19.
So just to reiterate, is there any discussion amongst Bell County of defying like these other counties against the governor's orders?
No.
I have a follow-up question for McLean Children's. It was really jarring for me. I saw a post circulating among the teachers groups of a wicker children's coffin that teachers groups are circulating as kind of a way to alarm the decision makers about what the school year might look like. What do you anticipate this school year will cause as far as COVID and kids going back to school without all the precautions that we had last year?
Yeah.
Is that what you come back?
Yeah, sure. I think that's a fair question. I think the story of the Delta variant and the pediatric population is literally being written right before our eyes. We're pretty early on in it. I've told you some of the concerning numbers that we have. I think McLean Children's follows the American Academy of Pediatrics. We want the kids to be back in school. We think face-to-face learning is the right thing for kids. But we hope that the community and the families in the community where we all live and have kids as well and go to church and participate in sports, we hope that they can see the idea that having kids back in school together and doing it thoughtfully and safely is something we can consider as a community. Even if there's not a mandate, it's something we can come together and try to keep each other safe, our families safe. Because even if it's not COVID, if it's RSV, if it's rhinovirus, if it's flu, we're expecting a really robust flu season as we get into the fall. these measures that we took really worked last year, and we're already at a pretty bad point. So if we can do simple things, not perfect things, but simple things to help mitigate that spread and make it easier on families that have to miss work for sick kids, on kids that have to miss out on education because they're sick, anything we can do, the tools that we have in masking, washing hands, social distancing, those are tools that we have. Once again, they're not perfect tools. The vaccine is as close as the perfect tools we have right now, but certainly we need to protect those 12 and unders by doing these things. And I'll also put in a plug that tonight at 6:30, in conjunction with KWTX, McLean Children's Hospital is having a back-to-school town hall. We're going to have pediatric infectious disease experts. We're going to have pediatricians. We're going to have pediatric psychiatrists on answering questions, talking about coming back to school in this environment and what that means for our community. That's going to be on the McLean Children's Facebook Live page. And also, I think it's Gordon Collier with KWTX is going to be hosting. Thank you.
Are y'all expecting the vaccine to become available for those younger, anytime soon? Is that discussion? Or?
Yeah, that's a little bit of a guessing game because that's happening at way higher levels than we're at. But we're hearing rumblings of maybe late fall that becomes available, and that's another hopeful tool that we'll have in that age group particularly.
I have a follow-up question. So
Sure.
like the judge didn't take enough to follow the law necessarily.
Yeah.
What are your thoughts on the governor's stance on this and the limitations that his order places as a medical professional?
Yeah.
Scientist?
What we've tried to do, the McLean Children's family, we're apolitical on this topic. We come from all walks of life and probably all political leanings. So we're looking at this as a community health issue, and we're just encouraging our community to do the things they can to keep each other safe. We're not going to jump into one political realm or another. We hope that people see the sense in masking and protecting each other, but we're not going to align ourselves with or against any particular political figure. That's not our job, quite frankly. Our job, as I said, we have been here before this pandemic. We're going to be here after it. We have served this community for 10 years, and this is the advice we're giving. Folks have taken our advice for a very long time. We hope they continue to through this pandemic.
I just had a follow-up to your question about the nursing and the mandated vaccine, et cetera. By God's grace, we live in a free country. And by living in a free country, in a free society, it carries responsibilities. As a professional registered nurse, that carries responsibilities. There's a great article in the Texas Board of Nurses newsletter that just came out from July about the vaccination and how to deal with vaccine hesitancy with the community. But I would speak to my fellow professional registered nurses, and as a nurse, not a CNO, but as a nurse. We took a lot of school to learn what we have learned. And I feel that it's a responsibility of nursing to set an example. And that example is get a vaccine, trust the science. What did you learn in school? What did we learn as far as what is required by the Texas Board of Nursing and our role with the community and public health? And so I just appeal to the registered nurses that feel they're either being forced against their will or whatever their leaning is, to just think about that and think about what you know about just the basic transmission of a virus. So I just wanted to follow up on that.
I just wanted to follow up on your question. We asked Dr. Charles Mitchell, one of our Greater Killeen primary care physicians. He's in private practice, but he's on our medical staff executive committee. You'd ask about the hospital perspective, but we wanted to be able to provide the community physician perspective as well. So Dr. Mitchell, would you?
First of all, I've been in the community for quite a while. I moved here in 1982 to Killeen. I was chief of emergency medicine at Dornell Army Hospital for the 3 years I was in the military there. I got out. I became chief of the ER at formerly Metroplex for about 20 years. And for the last 20 years, I've been doing primary and urgent care in the community. So I've been around here for quite a bit. What the impact of what you're hearing from the hospitals represents only about 5% of COVID patients. 95% of COVID patients never enter the ER, never enter the hospital. I mean, I shouldn't say never enter the ER, but they never are admitted to the hospital. Only about 5% of patients are admitted to the hospital. And the impact of that is occurring locally. We're seeing in the community, we're seeing a surge as is represented nationally. And that surge is a surge in pediatrics. We have a pediatrician that's working in our group. I asked him what was he seeing in terms of peds. He's seeing a significant rise in the cases of pediatrics. The youngest case he told me that he had seen was about 4 months of age. But most of these are still not going to be admitted. Most of these patients we're able to take care of at home, monitoring them at home. Oximeters are being used quite frequently, taking them out of quarantining them, and then getting them back into activity to their workplace as soon as we can when they're safe to go back. And I wanted to say a little bit about masking. Only because of information. I think you need some information, and information drive decisions that are made. And I want to point you to a recent study that was published, and this study was done by Duke University, a physician there, Danny Benjamin, who looked at over 100 school districts in the state of North Carolina, my home state, and over 1 million patients. I shouldn't say patients, 1 million students, K to 12. And in that, one of the questions that he was trying to answer is, what is the significance of mandatory masking? And this is not a political statement I'm making. I would like for you to go to that published information and look at it. What he found out that with everyone being masked, that is the staff and all students, and that was a study, again, over 1 million students, transmission was less than 1%. That's contrasted with 12 to 15% if everyone is not mandated. And I'm going to take that one other step further, because the basis is how do we keep the community safe? And how do you keep a community safe when you have a group of people less than 12 who can't be vaccinated? And the majority of the transmissions occurred in sporting activities. 50 to 75% of the case transmissions occurred in sporting activities. And a recommendation that he made there was at least vaccinate all the people, all the students 12 and over, if you are going to be involved in sporting activities. But when you see what's happening, you see these emergency rooms and hospitals all across the country that are full, and with the capacity and ICUs and pediatric ICUs and emergency departments not even being able to get a patient to the ER because the ER is full, having to spend 10 to 12 hours before you can find an ER setting to take them to. We have to do something at the base, at the foundation, to decrease that impact that's extending toward the providers. And there is a lot of fatigue. There is a lot of fatigue. My nurse practitioner, you know, she's overwhelmed. People are overwhelmed. We as physicians and care providers, before we even had a vaccine, we were there. We went every day to our station, our duties to provide the care that we needed to extend to patients. We're going to continue to do that, as was stated. But a little relief from the ground level is important, because fatigue is tangible.
Thank you, Doctor. One last question, if there is one, and we'll.
I have a question just about testing. We're obviously talking a lot about the vaccine. What is the testing front looking like? It sounds like there are people who are having a difficult time getting access to some of the free COVID testing. What's the availability of that?
Yeah, I'll look to maybe our health district. They could perhaps address some of those questions. Testing is again, at the 4 locations I went to yesterday, testing was available at one of those 4 locations. They're doing vaccinations, but they weren't doing testing. 2 of the 4 offered the rapid test that folks could purchase at those locations. But even at one of the pharmacies that is providing the testing, which was kind of the drive-through testing at that pharmacy, they were saying appointments were very, very full. So testing is, from my perspective, just on that sampling yesterday, testing is probably a challenge across the region right now in terms of finding locations to do that. But again, I would urge you to go online, look for those locations out there. And I don't know if Ms. Morrow has anything else to add to that, or if she would like to.
Yes, I agree. There are places that you can go online to look for where you can get a COVID test locally. There are some places whenever you go online to look, it will let you know what you need to present. If you need to present your insurance information or other types of items, we do have the link for that on our website. I also have our chief epidemiologist, Costa Claver, here, and he can provide a little bit more information about testing as he helps with our case investigations that do come in.
Thank you for having me here. Before I start saying anything, I would like to thank so much the healthcare providers, especially the hospitals. I call them our generators, because everything I'm having on my table comes from you. And especially the infectious disease departments, naming few, we have Elizabeth at Seton, we have Sunny's at Bella Scott and White, we have Elise at Advent Health. What you're doing is a tremendous job. As you're getting strained, we're getting strained as well. State to help us with a few AP contractors that we are working with. They're helping us to analyze cases, doing investigations, include reporting, because our public, they need to know where we're standing with the number so that they can take appropriate decision. As far as vaccines are everywhere, I will say. They just don't know, but we're trying to put up information there and on our dashboard. They can find almost all the pharmacy within stores, they're providing the vaccine. So I think that shouldn't be a problem. I know the line can be longer, but they're providing vaccine. I just want to follow up with the vaccine breakthrough. I think you were the one who asked that question. So recently I received a call from a nursing home, and unvaccinated staff who participated in a party and was exposed to COVID, and it caused the nursing home to get a breakthrough. 22 cases came positive. Among those 22, 21 were vaccinated and they didn't show any symptom. Only one who wasn't vaccinated was admitted to Scott and White. So I think that is telling us something, especially as far as vaccination. So I heard doctors, the healthcare providers here, they're talking about vaccine. And what is coming on my table most of the time when we're asking people, those who got admitted will be unvaccinated people. And most of those who are vaccinated will not even show any symptoms, but they can test positive because they were assumed to be exposed to someone. A mother called me yesterday. She was very concerned. She traveled from North Carolina. She tested positive, her and her daughter who is 17. But she's more concerned because of her daughter is getting very sick. She's not vaccinated, but the mother is vaccinated. So I think what our doctors have been repeating here over and over, I just want to bring that pragmatic situation so that we can know why we should get vaccinated. As far as the schools, and I heard you keep asking about the A38 order. Even if we follow that correctly, the number will go down. If you read that order itself, if we followed it correctly, the number will go down. So what we do with the school, we visit schools. Myself, I like going to every school and we'll talk with nurses. And our message is only one case that will come at school positive can cause an outbreak at school. So tell the parent, don't send the child at school when he was exposed or when he tested positive. Thank you.
All right, thank you, Costa. Please go get vaccinated. It's safe, it's effective, and it's accessible across the county, and it'll help keep you out of the hospital. Thank you for coming today.